Millions of Trump supporters could soon lose their health care, and they don't even know it. Lawmakers voted on the BBB without reading it, and now the president is hoping his base won't notice the consequences. But will they? Let's break it down. A major new law has just been passed by Republicans, marking a pivotal moment in American politics. This legislation brings sweeping, far-reaching changes to the American healthcare system, affecting millions of lives across the country. The law slashes funding for Medicaid and the Affordable Care Act, Obamacare, fulfilling a long-standing Republican goal that has been debated for years. With Trump now in his second term, the party finally succeeded in pushing the bill through, but it passed by a razor-thin margin, highlighting deep divisions. The most striking feature? The cuts are backloaded. The harshest effects won't hit until after the next midterm elections, delaying the real consequences. This delay allows lawmakers to claim victory now, celebrating their achievement, while avoiding immediate voter backlash that could threaten their seats. The Congressional Budget Office estimates nearly 12 million people could lose coverage as a direct result of these changes. These aren't just numbers on a page. They represent real families, children, and people with disabilities who rely on these programs for their health and well-being. The law also imposes new work requirements, making it harder for some to qualify for assistance. And it cuts nearly $1 trillion from Medicaid over the next decade, a staggering reduction with far-reaching effects. These aren't minor tweaks, they're fundamental, structural changes to the nation's safety net, altering its very foundation. Medicaid, for decades a lifeline for low-income Americans, is being redefined in ways that will reshape access to care. The focus now shifts from providing care to cutting costs, with profound and lasting consequences for millions of people. Supporters argue it's about fiscal responsibility and much-needed reform, insisting that changes will strengthen the system in the long run. Opponents, however, call it a calculated move that betrays the most vulnerable, putting politics above people's lives. The debate over healthcare in America enters a new, uncertain chapter, with both sides bracing for what comes next. The real impact will unfold slowly, over months and years, testing the political gamble made by those in power and the resilience of the American people. As the months pass and the changes take hold, the true cost of these cuts will become painfully clear for families across the nation. The question remains, who will ultimately pay the price, and what will America's healthcare future look like? Delaying the full impact of healthcare cuts was a shrewd political move. By pushing consequences past the midterms, Republicans hope to dodge voter anger. If millions lost insurance before an election, backlash would be swift. The bill's backloaded design gives lawmakers time to tout their win without facing immediate fallout. Senator Tom Tillis warned the bill would hurt eligible Medicaid recipients, calling it a broken promise. His opposition led him to leave politics, joining others disillusioned with the party's direction. Trump's second term brought fewer moderating voices, enabling a more aggressive agenda. The cuts were hidden in a larger bill, making them harder to block. The White House frames this as a promise kept, finally dismantling parts of the ACA. The narrow, tie-breaking vote from Senator J.D. Vance shows how divisive the issue remains. For now, the strategy has worked, the pain is delayed, and the party claims victory. But the clock is ticking. Will voters remember who made these changes when the effects hit home? The biggest losers from these cuts may be Trump's own supporters. Red states, many of which didn't expand Medicaid, will be hit hardest. Low-income families, gig workers, early retirees, and rural residents are all at risk. Many don't realize their coverage is in jeopardy, they just know they can see a doctor until they can't. New work requirements sound tough, but most Medicaid recipients already work or care for family. For some, meeting these requirements will be impossible, leading to lost coverage. Republican leaders aren't telling voters their health care is on the line. Instead, they blame others, supposed abusers of the system. The messaging is clear. The cuts target someone else, not you. But the reality is, the pain will be widespread and personal. The gamble is that voters won't notice until it's too late. The people most affected may not connect the dots until their benefits vanish. By then, the political damage may already be done. The paradox, the base that delivered victory may pay the highest price. Will they realize it in time? To justify deep cuts to social programs, Republican leaders often push a familiar story. They claim they're fighting waste, fraud, and abuse in the system. This narrative is repeated in speeches, interviews, and campaign ads, becoming a central talking point whenever budget cuts are proposed. By focusing attention on alleged corruption and inefficiency, the conversation shifts away from the real people who stand to lose coverage or support. Instead of discussing the impact on families, the spotlight is turned on supposed bad actors. It's a message that resonates with voters who are anxious about government spending and rising deficits, especially in uncertain economic times. By painting recipients as undeserving or even criminal, politicians create an us versus them mentality, dividing communities and fueling suspicion. The idea of rooting out waste is hard to oppose, even though much of what's labeled as fraud is often just people navigating complicated, outdated rules. The debate shifts from whether families deserve care or support to whether the system is efficient enough, sidestepping the human cost. This reframing allows leaders to claim they're protecting taxpayers and being fiscally responsible, rather than admitting they're cutting vital services for the vulnerable. The details of the alleged abuse are kept vague. The villains remain faceless, making it easier to justify sweeping changes. By redefining eligibility as abuse, politicians build public support for cuts, even when those cuts affect ordinary people. The narrative reassures the political base that only cheaters and rule breakers will lose out, not honest citizens. But in reality, millions of honest, hardworking people will be swept up in the changes, losing access to care or support they depend on. The strategy works, at least for a while, until the real consequences become impossible to ignore and the stories of those affected begin to surface. The question is, how long can this carefully crafted illusion last before the truth comes out? And ultimately, who will suffer the most while it does? The answer may be closer to home than many realize. The Republican strategy depends on convincing voters the cuts won't affect them. By blaming undeserving recipients, the policy seems reasonable, even necessary. This narrative builds a wall between the law and its real-world impact. The focus is on rooting out corruption, not on the millions who will lose care. Voters may support the cuts, believing they're fixing a broken system. The result, two realities. In one, the government is making common-sense reforms. In the other, millions face new barriers to healthcare. The gamble is that voters stay in the first reality long enough to avoid political fallout. But as the consequences spread, the truth will be harder to hide. Will the narrative hold, or will reality break through? Republican leaders don't just speak off the cuff. They carefully craft their language to shape public opinion and steer the conversation in their favor. Every word is chosen to influence how the public perceives their policies and intentions. Speaker Mike Johnson insists, "We are not cutting Medicaid." He claims they're simply fighting fraud and abuse, not targeting the program itself. He paints recipients as able-bodied young men who are refusing to work, using this image to justify proposed cuts as both moral and necessary for the country's future. Steve Scalise echoes this, claiming the cuts will save Medicaid for the truly needy. He uses vivid stereotypes and emotional appeals to distract from the real impact these changes will have on vulnerable families. Senator J.D. Vance urges voters to ignore the fine print, keeping the debate emotional and intentionally vague, so the public focuses on feelings rather than facts. The goal is clear: keep the spotlight on so-called lazy gamers and supposed fraud, not on the real families who risk losing their coverage and access to care. This rhetoric acts as a smokescreen, hiding the law's true effects and making it harder for the public to see what's really at stake. By redefining terms and creating negative images, leaders justify their actions as common-sense reforms, even when the reality is far more complicated and damaging. Supporters are encouraged to feel good about the cuts, as if they're protecting the system for future generations, rather than taking away vital support. The language isn't accidental, it's a deliberate, calculated strategy to control the narrative and keep the public on their side. The real harm is obscured behind catchy slogans and misleading stereotypes, making it difficult for voters to see the truth. The question remains, will voters see through the messaging and recognize the consequences before it's too late to act? Or will the carefully chosen words and emotional appeals win out over reality, shaping the outcome of critical decisions? The stakes couldn't be higher, as the future of healthcare for millions hangs in the balance. The big question: will lawmakers face consequences for these cuts? History shows voters often blame leaders for problems, but miss the details of policy. Republicans are betting on two things: weak opposition and delayed pain. If voters don't feel the impact until after the midterms, the party avoids immediate backlash. But when coverage is lost or hospitals close, the consequences become personal. Will voters connect those hardships to the lawmakers responsible? The party's success may embolden them to pursue even deeper cuts. Senator Ron Johnson has already hinted this is just the beginning. The ability to pass such a bill without revolt could reshape the safety net for decades. The gamble that messaging will outlast reality. But reality always arrives, eventually. The only question is when. This law is more than a policy change, it's a shift in America's social contract. For decades, Medicaid symbolized a promise to protect the vulnerable. Now, cost-cutting and work requirements take center stage. If these cuts succeed without backlash, other programs could be next. The new work rules ignore the realities of poverty and unstable jobs. Many who can't meet the requirements will lose coverage, even if they're working or caring for family. Medicaid risks becoming a work program, not a healthcare guarantee. When people lose insurance, they delay care, leading to worse health and higher costs for all. The savings today may mean bigger bills tomorrow. This law forces a national debate. Is healthcare a right or a privilege? The answer will shape the country for years to come. The true cost, human and financial, will soon be revealed. America's safety net hangs in the balance. As the law's effects ripple out, the ultimate test is political. Will voters harmed by the cuts change their allegiance? Trump's base has been fiercely loyal, but losing healthcare is personal. If supporters believe the cuts only hurt others, loyalty may hold. But when families can't afford medicine or doctor visits, politics gets real. These hardships can break through even the strongest identities. If enough people feel the pain, a backlash could follow. For now, the narrative is winning. There's no revolt yet. But as the backloaded cuts take effect, the pain will spread. The future of the Republican coalition and America's healthcare may depend on whether that pain is finally noticed. The clock is ticking. Will reality catch up before it's too late? The information provided in this content is for educational and informational purposes only, and should not be considered financial, legal, or tax advice. Always consult with a qualified financial advisor, tax professional, or legal counsel before making any financial decisions. The creator of this content is not responsible for any actions taken based on the information provided. Investments and financial decisions carry risk, and past performance does not guarantee future results. Remember to like and subscribe for more Money Smart Basics video.